W.E.B. Du Bois was an influential social scientist of the late 19th century. He wrote a book about the Philadelphia Negro, published in 1899. In that book, he had a chapter on Negro health. As he came towards the end of sharing the statistics of the large racial ethnic differences in health, he penned some powerful words. He said the most difficult social problem in the matter of Negro health is what he called the peculiar attitude of the nation toward the well-being of the race. And Du Bois continued, there have been few other cases in the history of civilized peoples where human suffering has been viewed with such peculiar indifference. So Du Bois is saying at the heart of racial disparities in health and why in 1899, American society has not made progress is what he called the peculiar attitude of the nation. Today, scholars call it the empathy gap, and it's well documented on every continent of the world that there is an empathy gap. And what do I mean by the empathy gap? We empathize with the suffering of persons from our own group compared to persons from a different group. And that is true, has been studied most prominently of the empathy gap by race and ethnicity, but it may be true for other groups as well. And this is not relying, this evidence, it's evidence in self-reported data, but this is not self-reported data. This is having individuals look at the pain and suffering that others are going through and looking at their empathic brain responses to that, and they document the empathy gap. Disturbingly, one study in the United States found at 5 years of age, there is no empathy gap among white children. You show them a picture of a person being stuck with a needle, and whether the person is Black or the person is white, they see the person experiencing the same amount of pain. By age 7, the children tend to see the white person experiencing more pain than the Black person, and by age 10, it is pronounced and stable. So we are seeing the development of this empathy gap very early in life. And why is that important? When you lack empathy for a population, you don't feel their suffering, and you do not support policies to address the challenges that population face, and that has been well documented in research by political scientists. One of the other challenges we face is dismantling the culture of racism. The racism that Dr. Jones talks about is deeply embedded in the norms, the values, the symbols, the language, the stereotypes, the behaviors, the assumptions we all make, and it's embedded in our social institutions. And we need to also work on dismantling the racism in the culture. I leave you with one statement from Martin Luther King. He said, "True compassion is more than flinging a coin to a beggar. It is recognizing and it understands that an edifice which produces beggars needs restructuring. We need to find ways to overcome these obstacles so that we can begin to restructure this edifice that is producing the inequality, this edifice of racism that is producing inequality in our society."